Alcohol is a carcinogen. It causes cancers in 7 sites of the human body: the mouth, pharynx, larynx, esophagus, female breast, liver, and colon and rectum. What we were asked to do by the International Agency for Research on Cancer was look at policies that could be adopted at the population level that would reduce the likelihood of people drinking, which would then reduce their risk of getting an alcohol-related cancer. What we found after a massive literature search that took 2 years and 20 people working on it was that taxes work, and that's probably one of the ones with the most evidence. Minimum age laws work. 21 is a good idea. It may not be popular with young people, but boy, does it save lives. Limits on alcohol outlet density, how many outlets there are in a community. Here in Massachusetts, we have more places to buy alcohol than we do Dunkin' Donuts. So limits on that. Limits on the days and hours of sale of alcohol. From the research that's out there, we can conclude, yeah, if you can do a strong ban on alcohol marketing, you can reduce consumption at the population level and reduce people's chances of getting cancer. One of the things we didn't find was enough evidence to say that discounting, things like bans on happy hours, was effective. Doesn't mean that they're not effective. We just couldn't find enough research evidence that they reduce consumption at the population level. Most of the research on happy hours has been about drunk driving, and that's a behavior. That's not about consumption. One of the places that we're most concerned about people not being aware of the link between alcohol and cancer is female breast cancer. In the US, about 15% of female breast cancer cases are caused by alcohol use, and 1/3 of them happen at consumption of less than a drink and a half a day. So what we were trying to do was find things that you could put in place at the population level, not at the individual level, but the population level, just to decrease the likelihood that people would drink as much as they do, so that we could decrease their likelihood of getting an alcohol-caused cancer.